Hello and welcome to the channel. I'm Irina Bondar, medical oncologist with over 15 years of experience in oncology clinic. On my channel, I aim to explain complex oncological questions in simple language. Today, let's talk about tumor markers. When applying for tumor markers is necessary and when it is not so essential. So, let's get started. Tumor markers are proteins or antigens that form in the blood. They can be produced by both cells, tumor cells and healthy ones. During malignant process, the concentration of tumor markers significantly increases. These markers have characteristics such as sensitivity and specificity. Highly specific tumor markers are specific to certain tumors and types of cancer, like breast cancer, prostate cancer, ovarian cancer. Elevated level of these markers can indicate the organ affected by the oncoprocess. On the other hand, low specificity tumor markers are synthesized during various oncological diseases and other pathological conditions. They can be also increased in various inflammatory, chronic processes, and many others. This means highly sensitive and low specific tumor markers may be slightly elevated in any inflammatory process, organ dysfunctions, or chronic illness. Therefore, only an oncologist can interpret this analysis. If necessary, the oncologist can perform differential diagnostics or prescribe additional examination if there are suspicions. But please don't do this by yourself. Don't prescribe tumor markers to yourself. If you found any abnormality in your body or want to check up, please consult a specialist first. Approximately 30% of cases with increased tumor markers test can be truthful. The rest are false positive or false negative. None of the tumor markers can prove or exclude the presence of cancer for 100% without additional analysis. So, if you are a healthy person without any oncological diseases before, and during your annual checkup you found out a slightly increased level of tumor markers, don't panic. Consult a specialist who will give you an appointment for additional examination and clarify this question. Now, when is the detection of tumor markers really important? If a patient has any tumor suspicious to cancer, tumor markers must be detected in addition to all instrumental and clinical examinations. In such cases, considering all your examinations, the specialist will establish the final diagnosis. This means that only an increase in tumor markers can't confirm or exclude cancer for 100%. The detection of tumor markers can be only in addition to the main diagnostic methods such as mammography, ultrasound, biopsy, and others if necessary. Tumor markers are often used to assess the effectiveness of the treatment or early control of recurrence or metastasis after complex treatment for patients with confirmed oncological process. For example, when a patient has a confirmed oncological process, the detection of tumor markers is carried out to assess the effectiveness of the treatment. During chemotherapy, it helps to understand if the treatment is selected correctly. After surgical treatment, tumor markers are determined to understand whether the operation was radical. If the tumor markers level decreases compared to the initial result, the treatment is considered successful. Another example. When a patient has undergone complex treatment for confirmed oncological process, was operated, or had core biopsy with confirmed malignant cells after radiation or chemotherapy. In this situation, according to the international standards, tumor markers are routinely followed serially, once every 3 months at first, then once every 6 months and then once a year. If the tumor markers level increases, it can indicate possible further progression of the process. In this case, the patients need to urgently consult a specialist for further examination and possible further treatment. Let's look at some certain examples. CA15.3 is a specific tumor marker for breast cancer. Please remember, during the primary breast screening, only an elevated tumor markers level isn't sufficient to establish the diagnosis. If you found a tumor in the breast during your self-examination or decided to undergo first screening, first you need to visit a specialist who will prescribe you breast ultrasound, mammography, perform biopsy, and in addition prescribe tumor markers determination. For ovarian cancer, the most specific marker is CA125. Sometimes this marker can be slightly elevated in oncological pathologies. To confirm or exclude the oncological process, gynecological examination, ultrasound, CT scan, and possible other diagnostic methods are mandatory, and in this edition, a tumor markers test should be done. Sometimes this marker can be slightly elevated in oncological pathologies. To confirm or exclude the oncological process, gynecological examination, ultrasound, CT scan, and possible other diagnostic methods are mandatory, and in this edition, a tumor markers test should be done. Now for men, highly specific marker is PSA, prostate-specific antigen. A significant increase in this tumor marker indicates possible oncological processes in the prostate gland. The prescription of this marker occurs only in addition to the main diagnostical methods. It is only a supplement for the complete confirmation on exclusion of the oncological processes. A slight increase in this marker is possible in non-oncological processes, but I remind you again, only the presence of elevated tumor markers does not provide for 100% cancer. It is just a supplement to the main examinational methods. Every oncologist knows that information, and there is a standard protocols for examination patients suspected of having an oncological processes. So if you have taken a blood test for tumor markers and one of them is elevated, do not panic. Go to a specialist who will check you, prescribe additional examination, and establish the correct diagnosis. I hope this information was useful for you. Subscribe to my channel and you will find a lot of important information. Take care and see you in the next video.